Hi, good morning. I am Dr. Pradyut Waghray. We are back again. Last week, we spoke on the CORAD's classification in COVID-19 cases. And today, I thought it is very important to know the role of the biochemical investigations which we ask in these patients, to know the relevance of each test and why to order these battery of investigations. So let us start from the first investigation, what we do, the complete blood picture. A simple complete blood picture or CBP can be very useful to us in COVID-19 patients. In the early stages of COVID, the leukocyte count or the white blood count can be normal or it can be low. But the important thing to see is the lymphocyte count. There is usually a decrease in the lymphocyte count. And if you have the facility, ask for an absolute lymphocyte count, because it is the absolute lymphocyte count which, if low, indicates a poor prognosis. So it is important to look for absolute lymphocyte count in CBP. So much so that if as the patient's condition gets more worse, the absolute lymphocyte count starts to fall down. So the difference between the neutrophil and the lymphocyte gets increasing. Therefore, the neutrophil lymphocyte ratio, otherwise called as NLR, if it is elevated, this is recognized as an independent risk factor indicating severity of the illness. Then also we do other parameters of investigations like ESR, CRP, procalcitonin, ferritin, interleukin-6, sometimes lactic acid. So all these parameters, why we should do this? Because these parameters reflect the body's inflammation and the immune status. And they are generally considered as warning indicators for severe and it is probably going to go into a severe stage. Thereby, by doing these parameters serially, they facilitate us to make a good judgment about what stage of clinical stage the patient is currently, and thereby we can modify our treatment strategies accordingly. A special word about procalcitonin, because we find that most of the patients from viral infections, including COVID, they improve, but then again, they get worse due to secondary bacterial infections. So if an elevated procalcitonin is there in a worsening patient, it indicates that this patient has superadded bacterial infection, thereby modifying your antibiotic therapy. Interleukin-6, which is commonly done, and also interleukin-10, but mostly we do interleukin-6, that if it is elevated, it indicates that this patient is going into impending cytokine storm, and this needs to be taken care of. So dynamic monitoring of these parameters like interleukin-6, absolute lymphocyte count, if you have interleukin-10, all these things, they help to assess the risk of the worsening condition of COVID patients, thereby modifying our treatment strategies. The other test what we do is commonly platelet count, prothrombin time or activated partial thromboplastin time, fibrinogen in some cases, D-dimer very commonly used, and FDP if it is available, or fibrin degradation products. So all these parameters, they are indicators that this patient is developing hypoxemia and going into multi-organ dysfunction syndrome, leading to coagulopathy and disseminated intravascular coagulation. So therefore, the close monitoring of these coagulation indicators in critical patients can help us in early intervention and thereby reducing their mortality. So decreased platelet count and fibrinogen levels associated with elevated PT, APTT, D-dimer, and FDP, they are all indicative of potential risk factors for a poor prognosis. Commonly, if you don't have the facilities for all these tests to do, at least a platelet count, which is very commonly used, by knowing that if the count of the platelet count is decreasing, and if the coagulation parameters like PT and APTT and D-dimer are increasing, then they are the risk factors for poor prognosis, which needs immediate intervention. The other set of investigations we ask is liver function test, lactic dehydrogenase, creatine phosphokinase, myoglobin in some cases, and troponin. So all these LFTs, CPKs, and myoglobins, they are actually indicators of involvement of multiple organs. So they indicate that there is a multiple organ dysfunction going on. Specifically, if there is elevated troponin levels, if it is elevated in critically ill patients, it indicates the involvement of the myocardium and carries a very poor prognosis. And this usually, if a COVID patient is complaining of chest pressure, pressure over the chest, or unexplained chest pain, then look for troponin, and if it is elevated, it indicates a bad prognosis. Therefore, all these parameters, the blood parameters, these corresponding clinical strategies should be developed according to the changes occurring in these biochemical indicators. There's no point in routinely asking for this test. You must understand why these tests are done, what they indicate, so that you can accordingly change your clinical strategies, thereby you're in an effort to improve the therapeutic effect of your treatment. Thank you so much.